Good morning, students. How are you all? So, back after a weekend. So, I am happy to know that you are really listening to the classes. So, that's why I could able to point out that I missed component 8. So, I think all are very keenly listening to the classes, taking down the notes. I'll tell next week to submit the notes. So accordingly you can submit the notes in Google Classroom. Okay, so what point I was missed is regarding the component 8 that is coming under Nrhm components. So Nrhm component 8 is about PPP, that is public-private partnership for achieving the public health goals including regulation of private sector. So why we have started is public-private partnership. We all know that majority are not, we need to achieve the goals as the government set based on the health issues that is prevalent in our country. But as public are not utilizing 90% or 100% public health services. So majority not ready to go to public health centers or hospitals to get the health services. They prefer to have little more better, they prefer to have a little more better services from private hospital. In that sense, they are going to private hospital. So we are not able to achieve this public health. That is why we have started providing the public health services with the help of private partnership. So for example, DOTS. We have DOT services in private hospital, AIDS, ART services. We have these services in the private hospital. Immunization, we have these private immunization services in the private hospital. In that way, linking and providing the services in the private hospitals, so that even though if they are not coming to the public from the private also, they can achieve this then they can get the health services, and we could able to achieve the public health goals. Since almost 75% of health services are being currently provided by the private sector, there is a need to refine the regulation. So that is why we have providing these services through the private sector. So according to the regulations of the private sector, public sector can provide the services. Thereby we can achieve the public health goals. District institutional mechanism for mission must have representation of private sector. Need to develop guidelines for public-private partnership in health sector. Public sector to play lead role in defining the framework and sustaining partnership. So we are continuing with that, and it seems to be very successful, and there is a sustaining partnership with these private hospitals, and we could are able to achieve it. Management plan for PPP initiatives at district, state and national level. So in all the levels we are implementing these kind of partnership, and it seems to be very successful, and we are continuing with this kind of health services. Coming to the last aspect under this Nrhm and Nuhm is about the differences between Nrhm and Nuhm. That is, Nrhm is National Rural Health Mission, Nuhm is National Urban Health Mission. Nrhm improves the rural health delivery system, whereas Nuhm mission is for the urban areas and focus on the slum and other urban poor families. Nrhm is launched on 12th April 2005 and Nuhm on 1st May 2013. Nrhm, we created ASHA, that is Accredited Social Health Activist, who is providing the health services to the major level. And in the similar way, we have USHA in Nuhm, that is Urban Health Activist, Urban Social Health Activist. One ASHA constitute of 1000 population, while one USHA in urban areas covers 1000 to 2000 beneficiaries, and that is 200 to 500 households. PHC or the CHC are present to provide health services, whereas in urban health center we have PUHC and CUHC is there to provide the health services. In Nrhm, the programs are running under that is Janani Suraksha Yojana, Rogi Kalyan Samidhis, Rashtriya Swasti Bima Yojana. And under NUHM we have Nehru Rozgar Yojana, Mahila Arogya Samitis, Urban Basic Services for the Poor, Swarna Jayanti Sabri Yojana. So these are the various programs running under this NUHM. So I hope it is clear. This is all about Nrhm and Nuhm. It is very important. Either one can be asked for university exam. So catch hold of it. Don't forget to learn about these aspects. Thank you.